people around the world now are taking microdosing. You don't even know it.
It seems like surgery is like having a moment. It seems like people are talking about it everywhere.
Well, the taboo is gone. There's no doubt about it.
He's like, dude, that's a status symbol. He's like, I want that scar. What do you want people to say about you when you're dead?
So GLP is a revolution, and we're in the midst of it. And sometimes you don't realize it when you're in the midst of it. Should I be on it?
All right, here we are with the Dr. Steven Dayan and, of course, Dom. Man, I don't think I've ever introduced you.
Who, me?
I know it's a big moment. It's a big moment.
I mean, I don't think I've ever,
podcast.
Do it, Ben. New York Times bestseller, the best rhinoplasty surgeon in the world. He's modest, so I'll keep going. What you got to expand on it, but the neurodermal sexual access is the new craze, and he's the leader of it. So I think that's something that's worth touching on. What else? I mean,
how about the fact that I gave you a job?
He gave me a job.
He did give you a job. That's a big deal. Let's just start there.
It was a big risk.
And you were a resident under me. I helped train you.
Yeah, you did. Yes. You've molded me in many ways.
Surgically,
mentally, physically.
Why don't we start there? What was Ben like as a resident?
Oh, it was the best.
Oh my gosh. He had this big beard and he was big and heavy and he walked around and he looked like a guy, who should be cleaning, hey, who is that guy? Is he here to fix the lights or the...
I mean, I kind of still have the same vibe.
It didn't seem like he was a guy who belonged in the operating room, that's for sure.
Yeah.
But he had incredible skills and talent. So,
yeah. Oh, look at that.
By far and away, the best thing ever happened to my practice.
Oh, look at that. Yeah, we've skyrocketed.
That's right.
And likewise, by the way, I remember I called Brian Wong, the guy who did my fellowship, and I'm like, hey, I'm thinking about joining Steve Dayan. He's like, all right. He's like, I'll tell you what. He will put you on a trajectory like 5 years ahead of where you could be without him. Like with the snap of a finger, which I would say, we talk about it all the time, how you open doors. You're not going to make people walk through them, but you're a guy who opens doors. And I think that's like a connector, opening doors. The opportunities are endless.
Yeah, it's really rewarding. I walk around now and I go to these meetings or, oh my gosh, Dr. Dayan, do you remember when, and there's so many people who worked for me at one time. I've probably hired 500 people or so now. And so many of them gone on to these great big positions, leaders of companies. And they started out in my small little office and they're all really appreciative. And it's really nice to, that's rewarding. You kind of live for that stuff. The older you get as much pride, if not even more so, from the people you train and seeing them do well than than the pleasure you get from your own winnings or successes.
It lives on. It's exponential. You know what I mean? You can only do so much yourself. I'm learning that. You can only do so much with your own hands. That's really what it gets down to. And then now Dom's in the loop.
That's right.
Dom is in the loop. I think we should call Steve the Godfather. That's basically he's the Godfather, right? This is where it should be.
And I've seen him take care of a few people too, when they need to be taken care of. Not by himself, but there's just enough distance. You're like, man, it seemed like he didn't like that guy. He's gone now. So be careful. Be careful in the comments.
So this is fun for me because these are two guys that I'm fortunate to spend time with. I know them both personally and professionally. Steve, we this podcast is all about how people are getting more of themselves. You have your finger on the pulse from an aesthetic standpoint. By the way, is that like an airplane I keep hearing? It just sounds like...
No, it's the train. I got the subway right outside here.
Oh, amazing. For all of you folks
have the
out
windows
there,
open for these kind of things. I mean, that's classic Chicago.
Yeah, that was classic Chicago.
Oh,
that was
so
amazing.
Classic.
What I want to say though is Steve, you so have your finger on. It's not just surgery, but it's always what's just happening in aesthetics and what's going on. And I think one thing that I think we haven't talked about, Ben, which is crazy because you're the co-host of this podcast, is it seems like surgery is like having a moment. It seems like people are talking about it everywhere. It seems like that it has somehow become a thing that people are so comfortable talking about. And am I just imagining that, or are you seeing that also?
Well, if you're asking me about that, the answer to that question is yes. We 100% know that. The numbers are reported. It's up. Facelifts are up 23%, which is really interesting. But what's even more interesting to me is if you look at the numbers from 1997 to 2025, or the latest data, the number of facelifts hasn't gone up. It's the same. It's still the same. And people, in fact, I was just on WGN today talking about the rise in cosmetic procedures, up 20%, people are saying, which is great because we had a dip last year in fillers. But overall, both surgery and non-surgery are up across the country. And surgery is much more so than the past. Having said that, the numbers haven't changed in some respects from what it was 20 years ago. So that was before the whole introduction of fillers and toxins and energy-based devices. So surgery took a little bit of a hit. Now it's back up. It's growing fast at a really incredible rate. A lot of it is due to the post-COVID boom. And secondly, to the GLP patients, those on Ozempic are a big part of what's coming in. Plus, procedures have gotten safer. There's more doctors doing it. So yes, there's no doubt surgery is taking a boom right now.
Yeah, it just feels like it. It feels like that people are also just more comfortable talking about it. Like people just seem like they're more open. I know, I'm in the age group. My wife's in the age group where all these women are saying, okay, so tell me about this surgery and tell me about that surgery. Obviously, I'm not an expert in that, but their comfort in asking about it, their comfort in the acceptance of it just seems like it's just changed over the last 2 years.
Well, the taboo is gone. There's no doubt about it. The taboo, it's not difficult to talk about, especially now, even menopause, which is driving a lot of patients in. But if you look at Ben's patients, you look at my patients, though, they're a little bit different. My patients are a little bit more discerning, a little bit less likely to talk about it. Whereas Ben's patients can't wait to get on Instagram and TikTok.
I had a guy, I swear to God, last week I did a consult with him, and I was like, yeah, man, I mean, there's going to be a scar up here. He's like, dude, that's a status symbol. He's like, I want that scar. He's like, I want people to know I have a facelift, And I'm like, great, let's get to work, man. I mean, there is totally that difference in approach that people have, right? So, there's somebody for everybody.
Well, it's good to see the stigma go down. I think people, we talk a lot on this show about people should get whatever is going to make them happy, like whatever is going to make them feel good. You should get what you want to get. One of the questions that I've heard, and I haven't had a chance to ask you this, Ben, but people have asked, is it better to get a facelift early or late? Is it better to go preventative? Like, what's the definitive answer on that?
Whenever they ask me, I normally say, for me, I wish you would get it this week because I got a couple of vacations planned and they're really expensive. I normally say, dude, that's a you question or a me question. I've done facelift in like beautiful 30-year-olds, just a little talk. They did great. I did one in an 88-year-old woman who hadn't had anything until she was 88. So, we can do it safely. It depends on what you want. It depends on the scar. It depends on your downtime, your money, how much, if you want to go to sleep, you want anesthesia. It's so complicated that there's plenty of 65-year-olds who look awesome. And there's plenty of 41-year-olds that look like shit and could really do good with a facelift. So it's so personalized that the age isn't the ticker.
As well as how you're defining facelift. If Ben does a little sneaky lift, that's a lot different than doing a deep plane facelift. So does a 35-year-old need a deep plane facelift? Probably not. But could someone has got some congenital issues and a obtuse neck benefit from a sneaky lift? Maybe.
Yeah. So Steve, you have from your perspective, you don't have a definitive answer on if it's young, if it's old.
Well, the younger you are, the more likely you're going to get a longer lasting result, a better result, because it's within the context of your age. Your skin is still very elastic. It holds in place. So you tend to get a great result if you're a little bit younger. When someone comes to me and they're in their 80s and they want their first facelift and they're saying, what can you do for me? It's like, it's going to be hard to make a huge difference because the skin just is not as robust.
Yeah.
And he's just healthier overall. You're working out, your blood's flowing, you're eating, high protein. So yeah, but at the same point, you don't want people to do it too early, right? Like if you're not ready, don't do it. It's that simple. I think it's one of those things that's worth having a conversation. I normally say, talk to me, talk to Diane, talk to as many people as you can about this. It's a big decision. We all have our own approach. That's the good part of having so many of us doing it, I'd say.
I think the key is that they see someone that's reputable. And I was talking about this today when I was on the news. There's so many people out there that are doing things and they're just not super well trained. And it's hard because we see it come in, and you're like, oof, I wish you would have gone to someone who was a little bit more experienced. Not to say that people who just get started are not good. Many of them are fantastic when they come out. But like anything else, the more you do something, the better you get at it. I don't care what it is, whether you're changing a light bulb or you're doing a rhinoplasty or a facelift. The more you do something, the better you get at it. The more facile you get at it, you just get better.
Speaking on that, Steve, like you are the rhinoplasty master. And
now you're doing facelifts on your rhinoplasty patients, so now you're the facelift master as well. Yeah, so
absolutely. No, I'm not taking that away. I'm not taking it away. I wanted to focus on the rhinoplasty because I think that's such a interesting thing for so many different people. And I just want to ask a couple of questions on that. I think, first of all, I think a lot of people don't know about this technique that you do that is different than the standard technique. So I want to ask about that. And then I think the second part about that is a lot of people are concerned sometimes, I think, with rhinoplasty because they feel like they're going to look so different. And I just want to get your thoughts on that as well.
So generally, there's multiple ways of doing rhinoplasty. I prefer a technique which is minimally invasive. It's called endonasal rhinoplasty. I didn't name it. I didn't give it a nifty name. I should have. If Ben was around earlier, I probably come up with some creative name.
We would have come up with something.
Yeah.
I mean, the preservation, there's guys trying to mimic it now. They're calling it the preservation rhinoplasty. Exactly. I was like, dude, you've been doing this forever. And you're like, yeah, I know. I just didn't. They beat me to the punch on the name.
Yeah. When I came out in practice, there was a big movement towards doing these big open rhinoplasty reconstruction of the nose. And I still do quite a few of those, and they're great for some patients, but they're not for every patient. So I found a way to do a rhinoplasty through small, tiny incisions in the nose and get really great results with limited surgery. So there's minimal downtime. I don't think I've seen a bruise in years. There's very little swelling. And a week later, I take the splint off, and most patients are like, oh my gosh, thank you. It looks great. And they're super happy. And that's where I've made a lot of success. I've grown my practice. I've been a real stickler and a proponent of keeping people looking natural. So if there's any bent against me or any criticism against me, is that he didn't do enough because I'm conservative by nature. So that's how I built my reputation. I make sure that people are going to look the same or look like themselves, but just look better. And when patients come to me like, oh, Dr. Dayan, I got you because ChatGPT says you're the best person to go to in Chicago if I want to look natural. So even ChatGPT realizes it, which is quite impressive to me. So that's how I built my reputation. Now, there are some people who do a much more aggressive rhinoplasty and they get great results. It's just not my style. Can I do them? I can. It's just not my style. And I think that today patients want to look natural. It's the number one concern they have. It's the number one barrier to entry for most of them is they want to look natural. They see so many patients out there who look bizarre and they don't want that. And the type of rhinoplasty I do fits perfectly into that need.
Yeah, you shouldn't be surprised. ChatGPT knows what it's talking about. So it kind of makes sense, right? I mean, what can you say? It doesn't lie.
Yeah, it's really impressive, isn't it? When you think about ChatGPT and how it's affecting us.
Yeah.
So the Dayan method of rhinoplasty is a non-invasive.
No, minimally invasive.
Minimally invasive. Sorry, minimally invasive. I'm sorry. But that cuts the downtime down by quite a bit.
Yeah, yes. I mean, generally speaking, with rhinoplasty, it takes a long time to heal. We tell patients it takes a year. But the swelling that you get after rhinoplasty is much less when I do my minimally invasive approach. So it's an endonasal approach, no scars on the outside, and tiny little incisions, and people heal much faster. So usually a week after I take the splint off, they go back to work and no one knows they did anything. They just think they look better. They can't figure out what it is. And most commonly, the comments they get is, oh my gosh, your eyes look great. And patients, we always laugh about it. I go, look, people are going to ask you about your eyes. And that's the most common question they get is because when the nose is symmetric and blends into your face, the first place people look is your eyes. You want attention drawn to the eyes because it's the most attractive feature of anyone's face. It reveals the most amount of information. And when your nose blends into the rest of your face, attention goes to your eyes. So that's how you know you did a good job.
The Dayan method. Did you hear that?
Listen,
Ben?
I want to know.
Did you get
I want to know more
you're
about.
You're going to just walk right over that, Ben? Come on.
What the
Dayan method? It's the Dayan method. Could you acknowledge it at least?
Trademark it, baby. I'm ready. I know it.
Okay. All right. I just want to say, can you at least at one time in this podcast say it later on, just the Dayan method for me, so I feel better?
Dayan method. Yeah.
Thank you.
It's smooth.
All right.
It's soft. It's slick. It's natural. Yeah. Come on. I can. I'm good at this. No. Listen. I like surgery. He's the best surgeon. But I'm more interested in the philosopher, Steven Dayan, because it's funny. The other day I was like, man, when I'm dead, people are going to be like, that guy hammered some good jaw lines. He made jaw lines like so sharp. And then I was kind of walking away. I was like, fuck, I hope that's not what people say about me when I'm dead. And like, it's like, what, I was going to ask you both, like, what do you want people to say about you when you're dead? Like, what? I like hit a moment, and I was like, what the fuck am I doing? I'm going to die, and they're going to be like, that guy made some really good jaw lines. And I don't know. I think I got to do something more profound in my life here. I make a good jawline. Don't get me wrong. I think it's okay if my tombstone is like in the corner, but I don't want it to be like the top thing on there.
That's pretty big.
The snatch jawline guy.
Yeah,
Steve,
like
you take that. You
say,
take that first.
You could be like in the corner. You wanted to say like, Dr. Steven Dayan made the best natural rhinoplasty, Dayan method, whatever. But what do you want the main thing to say? It's like shit.
I think everybody wants to think they left a legacy or they made a difference. Nobody wants to leave without thinking they made a difference. And for many people, that's their kids, right? Because you live on in your kids, and that's how the most tangible way of doing it. But I know I've always been driven by a motivation to make a difference in my field, to change the way the world thinks. And I've always been driven by that. It's never stopped. Now, the older you get, the more you realize you might not be able to do it, but that is a driving force for me. And it was resulted in me writing books and so many articles and chapters and videos and whatever I can do to get people to think a little bit differently. I love when I get into a room and someone says, I don't believe it, or that's not possible, that's not true. I'm like, now you got me motivated. So that's what kind of gets me excited.
And creating a skincare line within its own genre. I mean that's huge.
We did something that's new. And no one's done it before. And once again, I'm taking on a task that's it'd be a lot easier to slap my name on a skincare line like most doctors do. I am Dr. So-and-so, and this is my skincare line. You got to buy it. But I actually really did create this from the bottom up. But it came with all the science. I taught a course on the science of beauty for 10 years at DePaul University and wrote a New York Times bestseller on the science of beauty. So I took that philosophy and I put it into a book. It's about the science of attraction. And how do we attract people? It's not just the way we look. We like to think it's the way we look, but the way we look is just a small component of it. It's the confidence that you have. It's the charisma that you have that attracts other people. You don't have to be the most beautiful person in the world, but if you walk across the room, you strut with a confidence, that's who everyone's eyes are riveted to. They can't take their eyes off that person. You stand tall, you look straight ahead. There's so much more that goes into being attractive. We're just a small component of it. And our job is to make people feel more confident, to feel beautiful, not actually look beautiful. So I created a skincare line that leverages that philosophy and that thought process. And it's really interesting. I feel like we've overlooked that in plastic surgery. That's where we've gone wrong. And I think we can say the unnatural look and the people who don't move when their faces when they don't animate, there's no movement when they're trying to make an expression. Well, it's because we've been training wrong. We put more product, we fill the face up with filler, we pull the face tighter. It doesn't work because the minute you can see something was done, you failed. The patient doesn't look good. They look like that they have a genetic defect. They look like they're trying to make up for something, and they're considered less attractive. It's not about conformity. It's about confidence. It's not about symmetry. It's about sincerity. And it's not about perfection. It's about personal expressions.
And I think that's a good point, which we talk about all the time, which is the great outcomes are the ones that you don't know happened. They just look good.
You don't know why.
Right? Yeah. I like that.
Yeah.
I thought that was really good. And Steve, just for everybody out there, Steve's got a great skincare line. It's called XOMD. It's XOMD. It's a skincare line. It's a different take. You got to check it out. By the way, Steve smells good. You know what? Like a lot of medical grade skincare stuff doesn't actually smell good, but it's like it usually has base taste but it kind of smells kind of nice.
Well, it's intentionally clean. There's no fragrances in it. So it's interesting about that because we kept it intentionally clean so we can get approved in Europe and Canada and all around the Middle East and South America. And we're getting approved now because it's intentionally clean. And most products are not intentionally clean. 90% of the products that you have on these shelves are created industrial strength size. So they throw in inexpensive ingredients to get it out there to the market. And it pains me when I see people tout some of these products that just they're not well made. So I know that ours is well made. We're the first product line out there that was intentionally created to not only improve your skin quality, but also to improve social confidence. And I've been doing this for 25 years, so I've seen everything. And many of the products out there I've helped create. So this is the first time I'm actually on the other side, making it in the lab ourselves, and then doing a double-blind placebo randomized control trial. And I challenge anyone else to tell me who's doing double-blind, placebo, randomized controlled trials. It's not heard of. It's rarely done in cosmetics, so they don't have to do it. So when you put all that effort and extra attention into a skincare line, like I do with my patients, like I do with my articles, my writing, my teaching, you like it to be recognized. And now we just got 3 more awards coming this month that I got this week, but I'm under embargo. I can't talk about them yet. And I'm like, we're not even soliciting them, but skincare critics are recognizing it. Will the rest of the world recognize it? I hope so in due time. But people who know skincare are like, wow, this is something unique and different because it's the first one to ever prove psychosocial benefits on top of improving skin quality.
Yeah. And listen, good rise to the top. By the way, it turns out that clean smells good. So
you hear that, Ben?
I got it. You got it.
You got that? You got that,
Ben?
Ben?
My hair. I just walked home, man, and I walked fast because I don't want to be late.
Yeah. So Steve, what happened is we had Doris on, and Doris was inspirational for Ben in saying that she walks to and from work every single day. And very rarely, didn't she say, Ben? Like very rarely would she ever hop in a cab unless it's like raining or a snowstorm.
Yeah, unless it's storming or something. I'm the same. Yeah. Now.
Yeah.
So that.
But Doris is inspirational on many levels.
Oh, she's
so great. Sorry, I know. So I like the philosophy.
But Dom, you got to answer. What do you want on your tombstone?
Oh man, you came back to me.
Because you can't just be like, oh, MSP, great company, hundreds.
No, it's not that at all. I don't know if you guys had a chance to read my Christmas letter, but
great.
I do not believe in a legacy from a standpoint of your name on a building or this or that. It's all fleeting. I do think it's your children is a big one. I think if I could have anything that would tickle me is I wish I was just my legacy was, wow, that was a great leader and he made me feel inspired. That to me would be everything for me. If I had a, after I think about my kids and my children and playing music and that's probably the one for me. And Ben, you got to have a good one besides jawlines. Like what what's there?
I'm going to say the obligatory, I love my family. Yeah, put them on my tombstone. But the other one I'm still figuring out. I think I don't know it yet. It's probably going to be something out of left field. Like, yeah, I can't answer it. First got to fly or something cool.
It's a good question.
Yeah.
Steve, I think probably what makes you great at what you do too, and I don't know if a lot of people know this about you, like Steve is so well traveled. Steve has been in so many different places, and I know you really enjoy that. I think you get like great joy out of that. When you're out traveling, I mean, do things pop in your head? Is it a time where it gives you kind of quiet time where everything kind of slows down and quiets down a bit? And is that when kind of like a lot of ideas pop for you?
Absolutely. Every time I go away, I come back a different person because I get inspired. You see a different culture expands my reference range, different ways of thinking, different ways of acting, different ways of communicating, and all that influences the way I feel about myself, my family, and also my patients. I've done traveling for work. So I've done evaluations and studies where we studied beauty across the globe. And that was really inspirational to help me with work, but also with philosophy. I spent a weekend in Nietzsche's home because he's one of my favorite philosophers. And I wrote feverishly for 3 days. I couldn't get out of there. I was just like in a zone. And I used to do this all the time where I would take these writing retreats and I'd find some place that was inspiring to me and just write. And it's turned into a few books, but I'm in my happy place when I'm doing that.
Oh, that's really cool. And you've written a lot, and I'd like to go back to something you have kind of started to write and talk a lot about is just there. I don't think there's anybody else out there, definitely from a surgical perspective, talking about GLP-1 as much as you have. You had a very early identification that this was indeed a turning point in a lot of ways for a lot of different things. I know you have so much information. I think people out there want to know and hear about this GLP-1. I don't even know what my question is other than, can you just drop some incredible knowledge on us about GLP-1 and what you're seeing and what you think it is, and then also where you kind of think it's going in the end?
So GLP is a revolution, and we're in the midst of it. Sometimes you don't realize it when you're in the midst of it. And I think it's very much like when antibiotics was first introduced. never in the history in our lifetime has there been a drug that's going to have as big of an impact as this drug is right now. And I put it up there with like antibiotics because right now 70% of the U.S. population is overweight or obese. You have 60% in Europe, and the vast majority of the world is overweight. So or I said the vast majority of the world, but in many regions of the world, people are overweight. But the places we go, they're overweight, and obesity is also an epidemic in the U.S. So these people are all great candidates for this. And what this also tells us that sugar is a drug, sugar is a toxin, sugar is a poison, and we all eat sugar all the time. We don't realize how bad it is for us, and that's why we have these diseases like diabetes, which has many health ramifications. But one of them is obesity, and obesity leads to increased mortality. All of a sudden, I give you a drug that can stop you from overeating, that can drop your blood sugar levels. I mean, it's amazing what it's doing to people. Not only is it reducing weight, which is just one small part of it, it's now FDA approved for heart disease, reducing cardiac events by 20%. It's FDA approved for kidney disease, for liver disease. It's obstructive sleep apnea. So all showing benefits in those areas. Now for kids as well who are obese. How did 20% of our kids get obese? It's hard. I can't even believe we have 20% of kids are obese, but yes, that's the case. So all these people are now being treated by this medication, which is having incredible ramifications. But how about things like alcohol abuse, opioid abuse? 23% reduction in those. Dementia, reports up to 50% reduction in dementia. Maybe reduction in Alzheimer's is controversial, but perhaps cognitive improvement. So you start looking at what this drug does, and you're thinking to yourself, should I be on it? I mean, so when it first came out, it reminds me when Botox came out. When Botox first came out, there was no such thing as aesthetic medicine like there is today. There was plastic surgeons and dermatologists were dabbling with cosmetic medicine. But when it came out, it was just plastic surgery. All of a sudden, Botox comes out and it democratized aesthetic medicine. Now, all of a sudden, you can get a treatment in lunchtime, go back to work. No one knows anything done, look great, and it's relatively inexpensive compared to surgery. And there was no downtime, and the cost was there. So people were like, okay, so people started doing that. That took off, and I saw that coming. And so I was one of the first doctors in Chicago to really jump on that Botox bandwagon and help grow my plastic surgery practice. Same things with GLPs. It's just here now. I mean, it's not new. It's been around since 2005. The first one was FDA approved. So it's been around for 20 years, but its benefits we're just starting to recognize. And the question is, will we all be microdosing it one day? Now, I'm not an advocate for that, but I have done a lot of research and writing on GLPs. I've written 4 papers on it now. So I've dug deep into the literature on it to understand these benefits. And there's no doubt there's benefits even at small doses, but there's no double-blind placebo randomized controlled trials to say our low dose is safe. Having said that, many people around the world now are taking microdosing. You don't even know it. So their appetite might not be changing, but their blood sugar levels are controlled. Now, is that going to give you longevity? Maybe it's worth taking a look at. One of the reasons I got into it is because people started looking older quicker. And what was it? Was it they were just losing weight? Was it a grape turning into a raisin? And I didn't believe that was the case. So I searched the literature to try to find a mechanism of action. And I came up with an idea that I thought made sense to me. And this is going back into the biochemistry literature, that I found that when some of the early GLPs were turning off the adipose-derived stem cells. I'm like, hey, if you turn those off, then maybe the skin won't regenerate as well, won't respond to fillers as well. So I argued in a paper I wrote in 2022 about the effects of GLPs on adipose-derived stem cells maybe leading to early aging. That's why their faces are looking older quicker. Now, that was just theoretical. There was no proof behind it. There's been some papers now controversial. Some adopted my theory. Others have gone against it. But it's good because it opens up the discussion. That's where we need to be and how to treat these patients. So you're going to see the funnel of these patients is going to explode aesthetic medicine right now. When you think about that, 1 out of 8 Americans are now on or have tried these GLPs. So that's a huge funnel of people coming in. 65% of these people have never seen a cosmetic physician, but 22% say they're interested in seeing a cosmetic physician.
We should get our numbers because, I mean, I swear it's like 80% of my patients, I feel like, man.
Yeah. So we should be looking at this now because just the data we could have, if we all pool our data of how many of our patients are GLPs, I mean, we could start those numbers would be really fascinating to see because we're all trying to figure out exactly what it is, how many people are coming in, but they're all going to start coming into us because these were not aesthetic patients in the past. They were worried about other things.
Yeah.
So I think it's going to be a tsunami of plastic surgery and non-surgical treatments for all of us.
And Steve, when I think what a lot of people don't understand is that on a GLP, fat is, if it's changing the appetite, fat's getting reduced from everywhere. And that's part of the problem, right? Because we're losing fat in the face, and potentially at some points we're losing it quickly. And that's what's giving that older, kind of more skeletal look.
It's the fat that we're losing from the face seems to be a little bit different than the fat we're losing from aging. When you age, we think it comes from the deep fat pads. But when we lose the weight from GLPs, it seems to be more the superficial fat pads. An article came out earlier this year by a guy named Sharma, actually an otolaryngologist, who said that's most commonly, it's you lose for every 10% of weight you lose 11% of volume of your face. And most of that's coming from the superficial fat, not the deep fat. So you're losing about 40% more superficial fat than deep fat, which is interesting, which is different from what we've had in the past. And another article came out, which was never published, but it was a poster that was presented at one of our meetings. It's the temple area and it's the cheek area that seem to be the two areas that people are losing most of fat. So if someone walks into your office, you can kind of recognize them right away because they look a little bit different. They've lost this fat, they've lost this fat. And that's a unique look. You see it in marathon runners also, but you see it in the GLP patients more commonly. And they're losing fat everywhere. But the interesting point is they're still having pockets of fat they're not losing. So things like cool sculpting, which have taken a little bit of a hit, may come back if people want to lose some spot reduction for some of the areas that they're not being able to lose the fat. For the face, we probably want to use biostimulators, at least to start out with that right away, to start replenishing. Some of the skin and adipose-derived stem cells are probably turned off, so we want to rev those back up. And there's ways to rev up the adipose-derived stem cells, which are your pluripotential, your progenitor cells. They're the ones that convert into fibroblasts, which then create collagen. So they're like the engines, and then you want to get those going, and you got to turn them on.
Right. And I know Doris Day had said, I'm curious if you feel similar. She was basically saying, if you let it go too far too fast, it's easier if you're addressing this as you're losing the weight.
So that's the prevailing consensus by all of us now, is that we should start earlier. The problem is these patients don't come in until after the fact because their fear is like, I just lost all this weight. I look great. And it's not until someone says, you're looking a little old. And they don't even see it on themselves. Someone else has to tell them.
Yeah, I bet, right? Because they're in their eyes, they're like, oh my gosh, I'm finally losing weight. Like this, like weight loss looks amazing no matter what, right? So I don't want to say is that straight dysmorphia? I don't know, but
no, but it's interesting you bring that up because you're going to start to see people who have like addicted to the GLPs and that they can't get off it because they love the feeling of being in control of your appetite. If you control your appetite, you control your emotions. If you control your emotions, your confidence goes up. And
the people with that food noise, I mean, they don't care what happens to them. They just, you can see it change their lives, honestly. Yeah, it's an interesting.
And alcohol consumption is down 75%. Imagine if you own an alcohol company right now. People aren't drinking.
Oh, I mean, besides the fact that there's all these alternatives, right, from an alcohol perspective. I mean, the alcohol industry has taken a gargantuan hit. GLPs have definitely hit it. I know psilocybin has taken a massive chunk out of it. I think we've joked on this show, Ben, that half my neighborhood is microdosing or full dosing. Depends on if it's a weekday or a weekend. But I would tell you that, like, I would not want to be in the alcohol business right now because it just seems like a very, very, very hard run. And again, I think what's interesting is, I'm sorry, Steve, I'm going to put something on your radar here, that you're probably aware of. Because GLP is helping with a lot of these addictions. Food, we talked about food, we talked about alcohol. I know Dr. Eliza Parker had said she had a patient come in who was drinking and doing drugs, and they don't want to do that anymore. We have a massive gambling problem for our youth right now. And I don't know, Ben, if you're hip to this, but there is a massive, massive gambling problem. Gambling is so accessible now.
Yeah, I mean, I always think about it when you see those commercials. You can just do it on your phone. I'm like, man, if you're addicted to gambling, you're screwed right now.
You're totally screwed. And the problem is there's all these gambling sites that are giving you money to show up and to start. But it's a serious problem. And, I have a 21-year-old son, and I asked him, I was like, do your friends gamble? He goes, all of them.
Wow.
He said all of them, all the time. And then I test my upbringing. I was like, what about you? He's like, no, it's stupid. He's like, you're not going to make any money. Like, you can just tell. He goes, if someone wants to give me an extra $100, I'll use the $100 and then I will never put $1 in. But he said, all my friends are gambling. Yeah. Like, it is indeed a thing.
It makes no sense to me. Think about it. Like, would you do anything where you're going to risk and lose over 50% of the time you're going to lose? Like, go to Vegas. Like, I'm not going to risk that. I work so hard for my money. The thought that you're going to lose 51% of the time, no matter what, even if you're the best.
Yeah.
You can never be on the winning edge. Yeah.
No, I just have a rule on gambling. I never would gamble on anything I can't control. So if you said, like, Dom, I bet you can't do 50 push-ups. Like, I'm willing to go ahead and take a bet that I know that I can actually control. But sports betting is nuts. Like, right? Yeah, but that's where it is right now. But as you guys know, like, we have all these quote unquote, we've just changed the name to make it sexy and call them prediction markets. And all these prediction markets are just gambling on every single thing. But interesting, the prediction markets are actually good at predicting things, because it seems like the consensus of the populace is actually in a place where as a whole, they're actually can agree on where something is going from a certain direction, which I think is fascinating.
That's interesting.
Right? When you think about it. And I know we just we took a detour there, but it was kind of a fun one.
But I do think it's working for that. You know, I also, like, I don't want to take it, man. It sounds like it makes you not like all the good things in life. Like, I'm like, fuck, I like having a beer. I like, you know, whatever. It's like everything people like doing. It seems like, because the depression rates are way up too.
No, so maybe GLPs?
Well, I don't know about with GLP, but maybe parallel, coincidentally, I don't know.
Well, anxiety and loneliness are up. I don't know about depression. You talk about major depression. I don't think major depression's up, but anxiety, loneliness are up. Social anxiety is way high.
Yeah, probably a good part of that. But it's just like, I've known people that have stopped taking it because they were just like, I don't know. I just felt a little bit like it was working on my brain, and it made me not, you know, people complain about, like, bipolar people.
Anhedonia. They don't want to do things that are pleasurable. I've heard that argument. I haven't seen that in studies. It hasn't played out that it's anhedonic. I mean, it takes you away from you wanting to do things that are pleasurable, but it's possible. Yeah.
Are we talking sex? Like, do you not want to have sex if you?
Well, there's some arguments. There's one article out there that comes out there that says that women want less, but men want more. I'm like, well, that's not really got the GLPs.
Who is the cohort on that? I think that's pretty easy. Yeah.
Yeah. Gosh, that's not a great side effect, but
there's also one saying it, like, engorges the clitoris and the penis, right? There's a couple, like the Ozempic.
No, people are saying they need to have filler put in there because they're losing fat in those areas.
That was me and Dr. Ben's last episode.
Yeah, we talked about, on the news talking about the filler and the penis for the.
That's nice. They call me on the news to talk about how to trust a facial plastic surgeon. They call you on to talk about fat penis. What does that tell you?
I mean, it says I'm versatile, is what it says.
Basically, they were like, look, a guy to come out and talk about filling penises with filler. Who can we call?
Yeah, who would answer that call?
To do? Oh, Dr. Ben will talk about that. Hmm? Dr. Ben, did you throw like on your TikTok? Did you go crazy on that?
I didn't really yet, honestly. I've been freaking swamped.
Oh man, okay.
Yeah,
missed opportunity.
We'll get it out there.
Okay.
Wait, can we just talk about how Ben is Mr. TikTok? When he first came in, no one was on TikTok. He jumped right on that, and he went like, vroom. He got like hundreds of thousands of people right away. And I get calls from doctors in the community saying, you better slow him down. You got to curtail him. What he's doing is not right. And I'm like, Yeah, I think they were just jealous because he was seeing 20 consults a week based on, people, everyone wanted to get to know him because his TikTok was taking off. Now, he was using a little profanity and he was out there, but hey, I was that rogue guy back in 2000 when I opened a website and I got a call from the professor saying, we don't think that's appropriate. We don't think a doctor should have a website.
You got to cross the line, man, if you're going to define it, so there you go.
From you opening a website to Ben setting the record for the most F-bombs ever dropped for a plastic surgeon socially. Incredible. Ben's, if you guys haven't seen Ben's TikTok, it's epic. And by the way, if you don't follow Dr. Dayan, you should definitely do that. He's got some great stuff on there and always, I would say Steve, always so thoughtful. The things that you're putting out there, like they are, and thought provoking. I think that it's really great. So if you're not following him, please do. Steve, so I think we should take a quick second. We got to talk about MD Hyperbaric because we're all pumped about MD Hyperbaric. There are guys that are a sponsor. They're taking good care, and I think we're so excited. We had them on. What we learned on that there are 14 indications that are from the FDA for hyperbaric. I know the chamber's in there. I know it's about to kind of light up. We're super excited about MD Hyperbaric. Steve, have you had a chance to just lay in that chamber yet? Have you done it yet?
No, I think it started up this week, right? We're just getting started.
Helen did her first dive today.
Yeah, that's what she said.
Yeah.
So now it's safe. We know we can try it.
Yeah, she didn't blow up.
Folks, nobody has to be worried about blowing up. That's a joke.
It's great. You know, I send patients for hyperbaric so frequently. It's amazing. It's such a part of our protocols now. It's so nice to have one here. It's something I really wanted. It differentiates us. And I think we're going to find so much incredible value out of it. Even if it's our pre and post-op patients, they'll likely heal faster. You know, people are going in at recreational just to feel good. So you hear that story all the time. So I'm sure our patients, though, are going to heal much faster with this post-laser, post-surgical, or even, you know, if they have any sort of delayed healing from whatever procedure we do.
And I keep saying, you know, the biostimulators, fat transfers, it just makes sense that it's going to make that stuff more effective.
It'd be great to do a study, wouldn't it?
It's no-brainer.
Wow.
We got the chamber. We could do it. We got the chamber. We can do it. Hey, Steve, I want to just go back to maybe something that I was kind of circling around in the beginning here is again, you always have your finger on the pulse on like what's coming and what's next. And you're at all these different conferences and you're seeing what's out there. Like, is there anything you can share that's kind of on the horizon that we should all be watching for? Anything that you feel is groundbreaking, or are we just kind of more in a stable space at the moment?
No, there's always so much innovation. And I'm really lucky because I get called by a lot of people. They want to tell me about their products and they ask me to be part of their think tanks as they look forward to moving these technologies into the market. So I know I'm going to Monaco in 3 weeks. I'm going to be presenting on a short-acting neuromodulator. It's from the same people who make Botox, but it acts fast and is done in two weeks. So in 8 hours, you see the results. Will that take off? Well, we're going to see. That's coming out soon. There is longer lasting toxins too, which are coming out. There's combination toxins, which are a combination of toxin and they're regenerative, so to speak. They're recombinant. They're protein. They're made themselves. They're not made from bacteria. They're engineered. So that means if it's engineered, you can kind of manipulate it to have additional benefits, maybe skin quality benefits or many other benefits. So those are coming also. So that's in the toxin area. In the filler area, we have excitement around new biostimulators that are coming to the market. Some that people haven't heard about before. I was recently in a conference where there's this new product you inject into the face and it gels once it's in the face. So maybe put a little bit in there and create implants in the face. So that may be coming. These are all early, so it's hard to say this is for sure going to be the next step. But I find that interesting. And then, of course, I'm interested. I'm convinced that neurocosmetics are going to come into play, whether it's mine or others, as I think we're going to start looking towards, I call it the neo-romantic era now in aesthetic medicine, which is going to be no more about categories, no more about wrinkle scores and severity of your brown spots and red spots and collagen and elastin. We're going to start looking at things like psychosocial benefits, like does your life get better? If your life doesn't get better, then why are you doing aesthetics? And I think it behooves us, it's our job to prove that your life gets better after you have aesthetic medicine, whether it's a facelift, nose job, toxin, filler, or skincare. And I think that's coming fast as people want to be treated as individuals today. And passions, expressions, emotions, those are things we're starting to look at next. And your skin and your brain are connected. If your skin looks good, your brain feels good. If your brain feels good, your skin looks good. We know that. But where we're going with this next is pro-social. If you're in the room with someone, you feel good. And you're like, how does that happen? Well, generally you feel good, but you can feel negative too, but you sense someone else. Before you walk into a room, You sense the health, the wealth, and the danger of that room before you even walk in. How do we do it? Your skin picks up on it. You have sensory signaling in your skin, and you send out signals to other people. You pick up signals. How do we do it? We don't know exactly how we do it. It's like dark matter. We know 95% of the universe is made up of dark matter. We don't know what the energy is. We also know that we communicate with each other. And I think we're just starting to learn how to take advantage of that, especially in the era of AI, where AI now, we don't know what's real. You want to know the person next to you is real. So we're picking up on that. And aesthetics is now leveraging the neurobiology of your skin to improve not only your appearance, but also to improve the way you feel.
And that's actually what it's all about. It's all about how you feel. Like we keep saying,
it doesn't matter.
People are doing all this to feel better at the end, right? I mean, are you doing something just to look good? You're doing something to look good so you can feel good. Is that a fair statement?
Yes, for sure.
Yeah.
And that's
right.
That's so I think our whole field is we're pivoting towards that. We're recognizing that, trust the science, follow the science. Well, that's a little bit of an empty phrase today, or at least it's doubted like it wasn't in the past. So people want to know more than just the science. They want to be real. They want to feel the people around them. They want to know they're better. They don't want to see a study that says they're going to have 20% more collagen or a 20% improvement in their wrinkle score. How does this work for me? How does it make my life better? And I think we have to question.
Yeah, I think for sure. And again, that's why I think personally, I feel so passionate about being so supportive of whatever anybody wants to do, whatever it takes you to feel better, as long as you're not hurting yourself, like, man, do it. Like you're doing something to feel better. Like it's a tough world out there, and we have to be in a position where we're allowing people the grace and the space to do what they need to do to feel better. And I think it's what you do. Steve, we got two final questions, but I want to ask you just like one question that I don't know. Like how do you decompress? And I don't want to hear that you decompress by writing and reading poetry. I want to know like, do you sit down? Do you watch TV for like, a half hour a night or an hour? Do you drool? Like, what do you do? Like how does Steve Dayan, a guy who is just constantly on the move, like what's the decompression? The gym. Yeah. Look, it's more activity. Do you see that? It's just more activity.
I clear my mind when I'm in the gym.
Okay. So it's after work and you go, it's after work, you go to the gym, right? And then you get back home, and then like, what happens? Like, where's the decompression? What happens?
I'm not a good sleeper, as you can probably imagine. So, I may try to watch a TV show, but truthfully, I rarely do that. I may scroll for a few minutes on social media or pick up a podcast or something that really interests me. And most commonly, it's a podcast of something that I find interesting, and I'll try to be not related to medicine, but something else, history or philosophy. Or somewhere out, even politics at times, but that could be too revving up at night. So more history or philosophy, and try to fall asleep to that.
Okay, so Ben, maybe you need to let Steve come over to your infrared sauna.
Come in sauna. I told him he's got one. You got one in your building, right?
You have one in your building?
Yeah.
Ben swears by it. Ben's saying he sleeps like a baby from it.
Really?
Hold on.
Yeah.
Hold on, I'll tell you.
That's a good idea. Maybe we should start doing that after work.
Yeah, because
mine's currently 66 degrees Celsius right now. It's on its way up, 94. I got in at 96 degrees Celsius the other day for 15 minutes. Oh, wow, 96 Celsius.
That's big.
You ever do cold plunges?
I don't really do those. No, it's I'll do a cold shower, but I don't have the plunge system here. I mean, I've done it before, but not consistently. But sauna, I do like almost every night.
Steve, Ben's been saying like the sauna is magic on the sleep. Like maybe that's you got to
literature on it is pretty good for sleep.
Especially if you got it in your building, man. You should give that a whirl.
Yeah, you know what? That's a really good idea. Thanks. That's a great tip.
Yeah. Well, this is more you. This is more you podcast. This is where you get more you. So we sweat your nose there.
We had a breathing guy on. I did it for like one day and then I quit. But
but you totally flaked on that, Ben. Like you should have totally kept that going.
Every day it takes like 10 minutes. Like I
did you? Yeah, but the Wim Hof thing I sent you was good.
I know it's great. It's just God
damn, dude, just
like
commit.
Download it in my brain or something.
Yeah, just commit. All right. Anyway, Steve, as part of the show, we always like to ask two really important questions. Like, what out there just in your field and what you're seeing that people should know about that is absolute magic? Like, it could be a treatment, it could be a product, it could be anything. It just works fantastic that people should just really, really say, yeah, this is great. Is there anything that comes to mind?
Yeah, it's easy. XOMD skincare.
Bingo, I knew it.
That's exactly. We knew that was coming. It's XOMD skincare.
It's a slam
Get it
dunk.
while it's hot. Get it
You
while
just
it's
set
hot.
me up.
Just
You
laid
laid
it
that
out
with a
for
rip.
you,
Thank you
man.
very much.
Just laid it
But
right
it is true.
out.
I mean, and it's like, what's new, what's hot, what's going to make progress? There's so much of the old stuff, or so many reiterations of the same thing. I mean, that's what's cool about the new
neuroscience.
line, so.
It's all about neuroscience today.
Okay, so the answer to that question is the new hotness, which is XOMD. Okay.
Yes.
What, Steve, is there anything out there that you look at and you're hearing people talk about it and everything, you're like, that's bullshit. Like, that's not real. Like, that doesn't work. Is there anything that just people are talking about? Because there's just our industry in particular is absolutely full of things that people are saying are the thing.
Well, as a general rule, I don't like to talk bad about things because you never know. These things come around sometimes, and what seems like a bad idea now turns out to be a good idea 10 years later when you find a different way of applying it. And that happens a lot. And I've seen that happen a lot with devices and products that kind of failed and then come back. And I've seen other products that are great, and then I think they're going to be great, and then they fail. That happens too. I guess you have to be careful with a lot of the people injecting things they shouldn't be injecting. And we're seeing some of that. So whether it's, exosomes are not made to be injected, or a lot of these peptides are being injected that shouldn't be, they're meant to be used topically. And there's a lot of noise about that on social media, and that kind of concerns me.
Got it.
So, and then the other thing that concerns me is this concept of filler fatigue that everyone talks about. Yes, there's a component when fillers go bad. And what drives me, and I think this is just BS, is when people are like, all fillers are bad for you. And it's just, you can't make a sweeping statement like that. When fillers are done well and they're done judiciously and they're done by someone who is conservative and knows what they're doing, the results are fantastic and they're great. And unfortunately, it gets a bad rap. So those are two things that I see and it drives me nuts.
Yeah, no, I appreciate that. And I think we've used this analogy here as, I mean, you can give anybody a set of paints. Not everybody's a painter. And I think when it comes to filler, obviously it depends on whose hands it's in. And I think that's what you're saying too, right? Like when it's in the right hands, it's done well, it's fantastic. Like it's a hard thing to replace. I mean, is there anything else that does what filler does and the way in which filler does it? I mean, we might say biostimulators kind of, but nowhere
really
near the wow.
Yeah.
Yeah. Right. Fair.
Yeah. Fair.
There's a train. You're not missing your train, are you?
You can hear it, huh?
Yeah.
Oh yeah, man, that thing's pounding.
I love it.
This is
So
Chicago.
my neighbor's got this office up
Real-
at the window. I'm like, I can't believe that's my view. Every time someone comes in there, they're like, that's the coolest view. I'm like, the train going by? It's so Chicago, People,
yeah, it is classic.
I haven't done this, but I just want to do this because I think it's important because we got Steve on and Steve is Mr. Chicago and I'm from Chicago and Ben's in Chicago. Like Steve, favorite pizza place in Chicago? You got to give us a.
I'm still looking for it, but if you're gonna pin me down, I'm probably gonna say Barnaby's, and no one knows what that is unless you're from Chicago. But I kind of grew up on it, so I still love it.
I feel like I remember that from when I was a kid. So
yeah.
Barnaby's. Still, a lot of folks don't know Steve comes from a Moroccan background. Is there a Moroccan restaurant in Chicago that like is a go-to for you?
Taboun, Taboun. I love it. It's out in the suburbs.
Yeah.
All right, that's good to know. By the way, Steve has taken me to so many good restaurants. Steve, favorite new restaurant in Chicago?
I have not been out in a long time, but I love the Adelino, the one you and I went to last time. I thought that was great.
That was that Prime, the new one, right?
Yeah.
Yeah, that was money.
Yeah.
I went there after you guys mentioned it. I went there.
Is that Adelino
Because
Prime?
you didn't invite me the first one, so I just went by myself.
Yeah, I like it. But,
No one invited you. You went alone?
I'm just joking.
Oh my God.
Because you guys didn't invite me the first time, so I just
All
went by
right,
myself.
we will let you come and hang out with us.
Our fellows are always like, they become such food connoisseurs. They come back to the operating room, they tell me all these restaurants. I don't even know about it, but they get so excited to be in Chicago to try all the restaurants. So they're usually the best resources.
That's a good point.
Steve has totally turned me on to so many good restaurants. Steve, what was that awesome Middle Eastern restaurant? that you that we went to? Do
Oh,
you remember
Vec,
the
we
name?
went to. That was pretty good. Vec.
Vivek.
Yeah. Another good
back.
one. Yep.
Avec. That was great. That was really great. Okay, Ben, now I feel bad. We didn't invite you to any time we went and ate.
Well, we did it on purpose, Tom. Don't you remember?
We did. We were like, Ben's going to tell us.
I'm in the freaking office slugging away, doing surgeries, making us all money, and you guys are like, oh yeah, having your cigar.
Ben is generating. Ben, we just figured you would say, no, I got to go home. My kids are home. I can't do it. I'm not going to do it. We just thought that's what you were going to tell us. We didn't think you wanted to hang out with us.
I know what's going on.
We love you, man. I don't want you to think that we didn't want to spend time with you. We did. We really did. We said, wouldn't it be great if Ben was here?
It was a good ride. It was good. I went by myself. I just sat at the bar. I just had a meal. I was like, oh, I bet it was good when they had it together. It'd be really good if I had a friend here right now.
He's following, he's sending text messages. I hate you guys.
Playing on my phone. Yeah.
He's just looking. He's looking at pictures of us together. Like, you know what I mean?
Exactly. Thinking like, man,
Ben, we love you, man. No, it's not like that. It's not like that. No, it's just Steve and I get together for dinner, and we just like we just do like a mind expansion every time we're together with each other for dinner. Steve, I think our next step is road trip. I think road trip would be our next favorite
step. I love that.
I know you love road tripping. Steve road trips everybody. Every single year do you road trip, Steve?
Every year I pick and I don't know where I'm starting. I know where I'm starting, where I'm ending, but I have no idea where I'm going to go. So I call it journey with no particular destination. And I just stop whatever interests me. I go for 4 or 5 days, or depending on how much time I have, maybe 3 days, a long weekend. And I just drive, and I'll pick a state and just drive it. Like, who goes to the middle of North Dakota? I do. And Arkansas or whatever. I just pick a state and just drive it. I see the most amazing things, meet the most amazing people. It's great.
That's awesome. Dr. Steve Dayan, amazing individual. First of all, Steve's socials, we'll make sure that we have it on the pod. But it's Dr. Steve Dayan. There's an only one and only. It's Dayan. Just so we're completely clear on that, make sure you check him out. Follow him. XOMD is his skincare. Make sure you check that out. He has it at Impressions in Chicago. He is a very busy surgeon, but he's not too busy for you. So make sure you check him out. And while you're there, you might see Ben. Come and see.
I'll be working in the background.
Working really hard in the background
there all day.
Yeah. If you want to come and have some caviar, or whatnot, and champagne and cigars in the front, is that what you're basically saying? And then Ben will be in the back, just taking care of business.
I'll be in the back working. I'm the burro.
Call myself the burro. Ben. Thanks, Ben. Thanks, appreciate it. Okay, guys. Steve, thank you so much for spending your time with us. We will let you go so you can hop that train.
All right, sounds good. Talk to you guys soon. Thanks.
See you tomorrow.
See you tomorrow.